Welcome to Section E of your BCBA exam preparation, Ethical and Professional Issues. This is one of the most important sections of the exam, not because it's hard, but because it's tricky. This domain is not testing your emotions. It's not testing what feels nice. It's testing whether you can apply the ethical code correctly under pressure. Ethics protects three things: your clients, your career, and the profession of behavior analysis. And if you want realistic BCBA-style ethics scenarios with instant explanations, you can practice at www.bcbamarkexam.com. Let's get started. Here's the formula for winning ethics questions on the BCBA exam. Step 1. Identify the ethical risk, not the emotional problem, the ethical one. Step 2. Prioritize client welfare, not convenience, not your feelings. The client. Step 3. Follow the code, not your emotions. Many wrong answers feel kind, polite, or supportive, but violate the code. And step 4. Choose the least harmful option available. Here's your exam tip. Most wrong answers sound nice, but they break professional standards. Ethics is not about being kind, it's about being correct. Section E covers everything related to your professional behavior as a BCBA. This includes core ethical principles like benefiting others and doing no harm. It covers professional competence, knowing your limits. It covers confidentiality, what you can and cannot share. It covers public statements, especially social media and advertising. It covers boundaries and multiple relationships. And it includes cultural humility and respect for diversity. This section is not about memorizing rules. It's about learning how to think like a professional behavior analyst. All ethics decisions are built on 4 core principles. First, benefit others. Your actions should improve client well-being. Second, do no harm. Even well-intended actions can still cause harm. Third, respect dignity. Clients have autonomy, preferences, and rights. And fourth, act with integrity. That means honesty, transparency, and accountability. Every ethics question on the exam traces back to these 4 ideas. If an answer violates one of these, even subtly, it's wrong. Ethics is not personal opinion. It is not convenience. And it is not about what you meant to do. Ethics is a structured decision-making framework based on professional standards. It is client-centered. It is systematic. And it requires you to justify your actions. Here's a very common exam trap. I meant well is not an ethical defense. Good intentions do not cancel unethical behavior. On the exam, you must choose the answer that follows professional standards, not the one that sounds nicest. Ethics is not abstract. It has real-world consequences. Unethical behavior can cause harm to clients, physically, emotionally, or financially. It can damage families by breaking trust and disrupting relationships. It can destroy your career through complaints, lawsuits, or loss of credentials. And it harms the entire profession by reducing public trust. Every time a BCBA acts unethically, it affects how people see all of us. That's why the exam takes this section so seriously. Unethical actions don't just cause one type of harm, they can cause many. Physical harm includes injury, neglect, or unsafe procedures. Emotional harm includes fear, shame, humiliation, or loss of dignity. Financial harm can include fraud, billing issues, or exploitation. Legal harm can involve lawsuits, mandated reporting, or criminal consequences. And reputational harm can permanently damage your professional standing. On the exam, always ask, who could be harmed here, and how? If the answer is the client, that's your biggest red flag. Being ethical means staying competent. Competence doesn't happen once. It's continuous. That includes continuing education, staying current with research, consulting with other professionals, and receiving supervision or mentorship. The exam expects you to understand that you are responsible for maintaining your own professional growth. If you stop learning, you are no longer practicing ethically. Competence is not optional, it's a requirement. One of the most important ethical skills is knowing what you should not do. Your scope of practice matters. Your training history matters. Your experience with specific populations matters. And your familiarity with procedures matters. You are not ethical just because you have good intentions. A very common trap on the exam is the idea that you can figure it out on your own. You can't ethically practice outside your competence even if the client asks you to. Confidentiality applies to more than just names. It includes data, treatment data, assessments, progress metrics. It includes records, clinical notes, reports, and documentation. It includes identifying details, anything that could reveal a client's identity. And it includes conversations. If a reasonable person could use that information to identify a client, it is confidential. On the exam, always assume confidentiality applies unless you are explicitly told otherwise. Many people think confidentiality is absolute, but it's not. There are specific situations where disclosure is ethically allowed or even required. If the client gives informed consent, you may share information within the limits of that consent. If there is a legal requirement, such as a court order, you must comply. If there is a serious and immediate risk of harm, disclosure may be necessary to protect a client or others. And in cases of mandated reporting, such as abuse or neglect, you are legally and ethically required to report. Here's the key exam rule. Confidentiality is not absolute, but, and this is important, you must always document your reasoning whenever you disclose information. Public statements include more than just formal presentations. They include social media posts, advertisements, websites, resumes, and even casual public comments. Every public statement you make must be professional, accurate, and ethical. That means no sharing client details, no exaggerating results, no misleading claims, and no misrepresenting your credentials. On the exam, if a BCBA is posting about clients online, even anonymously, you should be suspicious. Public platforms require higher ethical caution, not lower. Anytime you speak publicly as a BCBA, 4 things must always be accurate: your credentials, your scope of services, your reported outcomes, and your evidence base. You cannot inflate success rates, you cannot promise results, and you cannot claim effectiveness without evidence. A very common ethics violation on the exam is overpromising. If an answer choice makes outcomes sound guaranteed, it is almost always wrong. Ethical communication is honest, even when honesty sounds less impressive. Sometimes the ethical choice is to stop providing services. This may happen when the intervention is no longer effective, when the case moves outside your competence, when the client requests discontinuation, or when safety becomes a concern. But here's the key rule. You may discontinue services, but you may never abandon clients. Discontinuation must be ethical, planned, and supported. When services end, your ethical responsibilities do not. You must give advance notice whenever possible. You must provide appropriate referrals. You must securely transfer data and records. And you must support continuity of care. On the BCBA exam, sudden abandonment is always wrong. If a client loses services without support, that's an ethics violation, even if the BCBA had a good reason for leaving. Multiple relationships, also called dual relationships, happen when a BCBA has more than one type of relationship with a client, caregiver, or supervisee. For example, being both a therapist and a family friend, or a supervisor and a business partner, or a clinician and a babysitter. These situations are risky because they blur professional boundaries, create conflicts of interest, and introduce power imbalances. On the exam, if you see a situation where personal and professional roles overlap, that is an ethical red flag. Sometimes multiple relationships cannot be avoided, especially in small communities or specialized populations. But unavoidable does not mean unregulated. When dual roles exist, you must be transparent. You must document everything. You must seek supervision or consultation, and you must clearly define and maintain boundaries. Here's the exam trap. Just because everyone agrees to a dual relationship does not make it ethical. Consent does not erase power imbalance. Ethical practice is not just about rules, it's about how you interact with people. You must listen actively, accept feedback without defensiveness, collaborate with other professionals, and communicate clearly and respectfully. Many ethics violations don't start with bad intentions, they start with poor communication. On the exam, if a BCBA ignores concerns, dismisses feedback, or refuses collaboration, that is an ethical problem. Cultural humility is not a checklist, it's a mindset. It means committing to lifelong learning. It means reflecting on your own biases. It means letting clients define what matters to them. And it means avoiding assumptions. You are not the expert on someone else's culture. On the exam, ethical answers almost always respect the client's cultural values, unless those values directly cause harm. Culturally responsive practice means adjusting your services to fit the client, not forcing the client to fit your system. This may involve adapting interventions, respecting traditions, providing language access, and considering family systems. A very common exam mistake is assuming that what works for one family must work for all families. Culture affects treatment, acceptability, cooperation, and outcomes. If an answer ignores culture entirely, it is usually wrong. Every professional has bias. Bias does not mean you are a bad person, it means you are human. Bias can come from unconscious beliefs, past experiences, cultural learning, and emotional reactions. The danger is not having bias. The danger is not recognizing it. On the exam, the ethical BCBA is the one who reflects, seeks feedback, and adjusts their behavior, not the one who insists they are objective. Bias is dangerous because it changes how you see the world, it distorts your perception, it affects your professional judgment, it shifts your treatment goals, it influences how and what you reinforce, and it can distort how you interpret data. Here's the key exam insight. If a BCBA refuses to acknowledge the possibility of bias, that itself is a bias. Ethical practice requires humility. Ethics does not exist in isolation. It exists inside legal and regulatory systems. As a BCBA, you must understand licensure laws, certification rules, funding requirements, school system regulations, and insurance policies. Ignorance of the law is not a defense. On the exam, if a BCBA ignores legal requirements, that is an ethical violation, even if their intentions are good. You are responsible for knowing the systems you work in. Ethics and law are related, but they are not the same. Something can be legal but unethical, and something can be ethical but illegal. When these conflict, you must follow the stricter rule. Ethical standards usually go beyond legal minimums. On the exam, do not choose the answer that is just barely legal. Choose the one that best protects the client and follows professional standards. And always document your decisions. Here's what Section E is really about. Protect your clients, protect yourself, and protect the field of behavior analysis. Ethics is not memorization, it's professional survival. The best way to master ethics is to practice real scenarios, not just read rules. If you want realistic BCBA-style ethics questions with instant explanations, you can practice at www.bcbamarkexam.com. Thanks for studying with me, and I'll see you in the next section.